This patient just finished getting a robotic hysterectomy, and it was my turn to place a sling for stress incontinence. My preferred sling is the Boston Scientific Lynx. First thing I have to do is inject some numbing medication around the urethra. Then I make a 1-inch incision in the vagina under the urethra. Next, we open the sling, which is a long piece of mesh. It's blue in color, and you can see there are these 2 knitting needles that I have to use during surgery. I make puncture wounds just above the patient's pubic bone on either side of midline. So there's 2 puncture wounds here. And then I use those curved knitting needles and go through the patient's skin and through muscles until the end of that curved knitting needle has come out through the vaginal incision that I made. And these knitting needles rest on either side of the patient's urethra. I need to make sure that I didn't puncture the patient's bladder on the way in, so then I do a cystoscopy, and as you can see here, I do not have any trocars going through the patient's bladder. Phew! After that, I hang the sling on both of those trocars, one end on the right one end on the left one. And then I carefully pull the trocars out of the patient's body. And as I do that, the sling then rests under the patient's urethra like a hammock, supporting it nicely so that when she coughs or sneezes, it no longer moves and causes incontinence. The excess mesh is cut away, and I close the incisions with super glue and dissolvable sutures. Another successful case.